let's now delve into this with our correspondent, Angelo Coppola. He joins us now in Johannesburg. Angelo, always good to have you with us. Now, of course, the first question that comes to mind is why Aspen Pharmacare will be facing a collapse in demand, especially given the fact that South Africa itself is expected to experience a fifth wave of the COVID-19 virus, and it also has less than half of its population vaccinated right now. What are the realities on ground that have led Aspen to this point?
Well, we know that imminent fifth wave is almost upon us, and all indications are, though, that hospitalizations are likely to be lower than previous waves, and it's because of that that people don't feel the need to get vaccinated or to get those booster shots. In fact, some medical practitioners are telling their older patients to avoid the booster shots altogether. Experts are also suggesting that with an end in sight, or the end of the state of disaster as we knew it a couple of weeks ago, people are less inclined to get vaccinated as well. So there's this complacency and apathy that's been following the 2 years of lockdown regulations that we faced in South Africa and that are now over. And people are genuinely just fed up, and that slump in local demand is probably a real concern, and it's due to this lack of apathy that we're facing. And that's what's led to this lack of purchasing of the vaccine from our friends at Aspen.
We're looking at it at a continental level. Aspen Pharmacare was actually supposed to be Africa's first COVID-19 vaccination plant, as of course other production facilities are yet to be set up. Now, the facility was expected to be at the front lines of solving Africa's low vaccination rates, and certainly to help also with sluggish Western handouts when it comes to vaccines. Is there a reason that the rest of Africa is not galvanizing this plant?
Well, Uche, it turns out that it's not about supply, it's about demand. If national governments in many of the African countries can't galvanize their populations to get vaccinated, there's no way that a local pharma company like Aspen can convince people in South Africa or anywhere else on the continent to get vaccinated. Aspen would welcome, they say, expressions of interest, but it is the two big procurement agents, that's COVAX and Gavi, that hold that financial muscle to buy in bulk and to get those much needed bulk discounts. Those two groups have had, and in fact have continuously expressed their commitment to support African manufacturing initiatives like the one at Aspen in the lead up to the signing of that deal for that license with J&J. Now I'm told there's a distinct silence around what those two groups actually want. Aspen executives told me that they wanted some clarity from the two groups, but meanwhile the conversations are in fact continuing, we're told, but it's a commitment to what kind of production they want from Aspen and from the other initiatives.
Well, looking forward, we hear that African leaders are holding those emergency talks to see if they can throw the plant a lifeline. What is the expectation of those talks?
Well, look, it appears that those leaders have also been engaging with the two procurement agencies individually and as regional groupings to no avail thus far. I'm told that South African President Ramaphosa, as the AU champion of the vaccine, has also thrown his weight in behind those calls to get a firm commitment from those two groups, also with no effect. It's unclear how African countries can throw Aspen a lifeline, though, other than perhaps ordering the vaccines from Aspen directly and paying for them. Aspen's strategic trade executive, Stavros Nicolaou, says that there are no orders on their for their vaccines on their books from anywhere. So that's a problem. The question remains, though, whether there is any demand for the vaccines on the continent, and that has to be dealt with first, Uche.
Well, this has also raised questions about the sustainability of building facilities that only produce COVID-19 vaccines and pandemic vaccines. Is Aspen built to only produce these COVID-19 vaccines? Can its capacity sustain other vaccines which Africa needs?
Well, look, Aspen's Nicolaou did say to me earlier today when we spoke to him that the 2 lines they've allocated for the COVID vaccine production can and will be converted to manufacture other products and take care of other vaccine production as it happens. What they can't afford to do, I was told, is that they can't have those lines to be left dormant for much longer. He used the word imminent in terms of a decision that's going to be taken about the closure of those 2 lines, and he mentioned that word several times. We do know that the design and development of that plant in Gqeberha in the Eastern Cape was always going to be multi-product. for a range of products that Aspen produces for many different contract clients, including J&J. And it seems that they're ready to pull the trigger and convert those lines sooner rather than later. Uche?